in the globe. So thank you so much. This is an interactive show, though. So you can always reach us in the studio at 850-304-7786. And let me tell you, we are back here on Limitless Talk. I am your host, Lady Limitless. We have DJ Jerules on the one and twos. And then we have Dr. Charlene Tucker in the building, a true powerhouse in physical therapy, blending her Jamaican British roots, or British Jamaican roots, I should say, with over 2 decades of expertise. So whether you're an athlete, a weekend warrior, or just want to keep with the grandkids, she's here to share her secrets on how to keep your body strong and your mind strong throughout your golden years. Dr. Tucker, welcome back to the
Thank
show.
you. Thank you.
Awesome. So, prevention over cure. If someone was listening right now, I'm going to jump right in, right? And wants to stay out of your office, you said the first thing that you would tell them to do is it was it pain not normal or is it sleeping properly? I want to make sure we catch back up to where we were.
Pain is not normal. So if you have pain, whether it's back pain, neck pain, shoulder pain, wrist pain, whatever the pain is, that is not normal. So you should go and get an evaluation from a physical therapist and have them see what your limitations are and guide you in the best possible way. Yes.
Okay. All right. So it's pain is not normal. We've have the lines open. 850-304-7786. We have a question for you, Dr. Tucker. It says, what are the best steps for managing the pain in the short and long term for someone who's had a car accident and has lingering back pain and neck pain, stiffness, or just overall pain? What do you have to say to this listener?
So, in the short term, if it's an acute accident and you're having pain, then you can always use ice. It's one of the easiest and most natural ways to decrease inflammation.
Mm-hmm.
A heating pad, massage therapy. But in the long term, it does depend. So I always suggest having a physical therapy evaluation. If
Mm.
you come to see me at Holy Cross, we do 40 minutes of individualized treatment sessions where we would do a personalized evaluation and figure out where your limitations are, take measurements,
Mm.
look at strength and function and mobility, and then prescribed a specific plan of care suited for you, whether that's exercises, stretching, manual therapy, cupping, dry needling, and other modalities like
Oh,
that.
so there's going to be like a robust plan of care for your healing.
Yes,
I
yes.
love it. So, how much mobility is in exercise? Like, how much is just how we live and move throughout the day? And, like, how much is like rigorous, like weightlifting?
So, a lot of people have to understand that just because you walk the dog and you do housework and you have an active job, that is not considered exercise. Exercise is what you do and do above and beyond your daily routine.
Mm,
So, yes, it is good to have a physical job. Yes, it is good to go and walk the dog. But I would like for you to do and take into consideration that you walk the dog, you put the dog back, and then you go and do a specific walk, intentional walk for yourself.
mm,
Um, Strength training is definitely important, especially as we get older. After 50, I think it is, we lose 2% of our muscle mass each and every
mm.
year. And so, in order just to maintain that, we have to lift weights. And you will not get big, you will not get too muscular and look masculine if you're a female. But consistency is the key to be able to maintain that as you get older.
So, do I have to like lift like 20-pound weights, or is like five a good way to start just to kind of get it started?
Yeah, absolutely. No, you can start with body weight exercises,
Oh,
wall push ups, squats, planks, just
okay.
doing floor mobility exercises initially. But yes, you do eventually want to lift weights. And no, you do not have to start off with a 20-pound dumbbell or a kettlebell. You
Okay.
can start off with some light weights. But that's where the physical therapy comes into play. If you have an evaluation with a physical therapist, we can definitely guide you on those steps.
Okay.
So you don't, follow follow something on YouTube and get injured and then have to see me anyway. So just come and get an evaluation to start off with. It doesn't need to be months and months of physical therapy, but yeah, you can at least get started on something.
So wait, are you trying to tell me don't follow the TikTok doc?
I mean, you can,
It
but
just end up in your office, right?
You just end up in my office.
So
Just take the precautions and see a professional first.
I love it. I love it. So, what's one quick daily stretch or movement that could save us years of aches and pains later? The plank, maybe?
A plank is good as long as you don't have any, shoulder issues. But again, my go-to is walking.
Okay.
Get up and walk. It's easy. You can do it. Even here in sunny Florida, go to the mall where it's AC, and just go for a walk. That's my best advice, just for somebody starting out.
Okay. All right. So, how does your British Jamaican background show up in the way you connect and motivate your patients?
Good question. I think I try to treat most of my patients as if they were family. So a lot of the times I do say, if you were my family member, if you were my cousin, then this is what I would do. I it's difficult to seek care sometimes from healthcare professionals because you don't know what their best interests are. But the family aspect for me is really important. I do like to treat my patients the best possible way I can.
Oh, and it comes across. It comes across. It definitely does. So you're a fitness buff. How do you personally keep your body feeling young and strong?
I go to the gym a couple times a week. I go on the Stairmaster 30 minutes. Then I go and lift some heavy weights, squat machine, deadlifts, lunges, bicep curls, use the machines, and also do mobility too. Mobility, stretching, yoga moves, Pilates moves, such things.
Nice, nice. And if you could leave our listeners with one piece of advice to keep them mobile, happy, and healthy for life, what would it be?
Start now. Don't wait. A lot of my patients come to me and they wish that they had started sooner. You're never too late to start an exercise program. You won't regret starting, but you will regret not starting.
Yeah, I can see that. I definitely can see that. All right, quick fire. Dance hall or reggae? You better not say soca. You better not.
Hey, soca. I do love my soca now.
It gets you vibesy. Let me tell you, if you're able to see us, you see she's in her gold. She's giving you all the goddess energy right now. She definitely loves a good vibe. You can feel it in the studio today. Heels or sneakers, Dr. Tucker?
Sneakers every time.
Rice and peas or fried dumpling?
Rice and peas.
So if you weren't healing people through physical therapy, what would you be doing full time?
I would be working somewhere else in healthcare or exercise promotion, health promotion, something along those lines.
Okay. Yeah. What's your go-to song when you need a good mood boost? Soca.
It is going to be
I
soca.
knew you was going to say that.
It's going to be soca. Big up to Carabana in Toronto.
All right. What's your favorite dish you cannot live without?
Before I was vegan, fish and chips.
Okay, but you're vegan now, so let's talk about that. Let's bring it to the current day.
Okay, some rotis, some vegetable roti, doubles.
Yeah, okay. All right, and then what's one piece of advice you give to your younger self?
Start exercising sooner.
Really?
Yes. After my ACL surgery, I did let it go astray for a while, but now I'm back. Yes.
Oh, man. Listen, it has been a pleasure. Thank you so much. What a conversation today with Dr. Charlene Tucker, reminding us that health isn't about fixing what's broken. It's about caring for our bodies now, and that can carry us for years to come. We've learned about the power of small daily movements and the importance of breaking that bad attitude and lifestyle habits and now staying active and what it means for you in the long term. Dr. Tucker, thank you so much for not only sharing your expertise, but for inspiring us all to treat our bodies like the priceless gift that it is.
Thank you for having me. It was
You're
a pleasure.
The best. Good day. Stay tuned. You are tuned into INI Radio here with Dr. Charlene Tucker, who we're bidding a good day. DJ Rules and Lady Limitless on INI Radio. Good job, friend.
That was good.
Good job.